The broadcast is now starting. All attendees are in listen-only mode.
Good morning, everybody. Welcome to 2019. This is Pat Hennessy with Beere&Purves, and thank you so much for joining us today. Today, we're going to talk about how you can really get your 2019 year off to a great start, specifically in sales as well as in account retention. And so what we want to do today is to show you how to increase your sales and your profitability in 2019. We're going to walk through the top selling plans by county. We're going to go through a lot of the resources we have available here at Beere&Purves that we want to make sure you take advantage of. It'll make your life a lot easier. Why you should be selling each of the carriers. We're going to walk through the unique features of each one and when you want to use each of those. And then let's talk about legislation, because now that we call it the storm is over for most of us, where a lot of the business renewed in December and January. So now it's time to really make sure we've got everything in order. And now we switch our eyes on compliance, because that's where we're finding a lot of errors and a lot of brokers getting into trouble. So we're going to walk you through that. So today you can relax, because we're going to send you all of this material after the presentation, so you'll have it by the end of the business today. And hopefully at the end, if we have time available, we'll walk through questions as well. So let's go ahead and get started. So what we're going to do today is focus on what you should be selling in 2019. So as we go through each of the carriers one by one, you want to pay special attention to this slide. This is January, February, and March. Top carriers. These are all the 19 carriers for the rating regions here in California. And you'll see down the left-hand side, you have platinum, gold, silver, bronze, and HSA as well. And across the top, you'll see the different areas. And again, in the bottom center, you'll notice that we have Contra Costa County, Area 5. So in January, February, and March, what should we be selling? Well, if you have a group that's on a platinum plan in Contra Costa County, they should be on the Anthem Blue Cross plan. You'll notice to the right, there's a minus 8.22%. What that means is that the Anthem Blue Cross Platinum Plan, zero deductible, is 8.2% lower than any other platinum plan available in the first quarter. This is really helpful for you to know, because you know immediately if you're prospecting and somebody's on a non-Anthem plan, you can save them 8% right off the bat. So as we go through this is a great tool that you want to keep in mind and take it out to your prospect meetings, because right away, if you know that your renewal's coming up and they're on the Anthem Blue Cross Platinum Plan, PPO, that is the most competitive plan, and you don't really need to be adjusting it. We always go through the rates just to make sure that you've done your due diligence, but this is going to give you a good indicator as to what's going to be hot coming up in the first quarter. You'll notice in San Francisco, to your left there, Area 4, it is going to be Anthem and United. And you'll notice in, again, Contra Costa is Anthem, and Aetna is going to be your silver plan. And again, each of these are going to be fluctuating every quarter, and we do this every quarter so that way you have an understanding of what you're going to be focusing on and which carriers are not competitive, because you'll notice right away there's some carriers not showing up here. So those, unfortunately, are the ones that are more expensive in the first quarter. So what I'm going to do is take you through this tool. These are all of the areas, and the way we structured this is to make sure that you know in the Bay Area, Northern California, are the first couple of pages. Now we start talking about Southern California. You'll notice it's labeled there at the top. And this will tell you if you have groups in where the employer is located. If they're in Los Angeles, for example, you'll notice, depending on the area and the zip code, this is what you want to be using in order to make sure you're providing with the most competitive rates. And at the very end, if you don't know where or which of the 19 rating regions are corresponding with which city, there's the legend. So that'll be helpful for you. So now let's go back into the presentation now that you have an understanding of how that works. So first of all, let's talk about why should you be considering using Beere&Purves, because what's happening is the knowledge that we have here and the tools and resources are items that are really going to save you a lot of resources internally. And again, the whole point of today's discussion is how can you increase profitability at your agency level and free up capacity so you're going to grow your sales and reduce your internal expenses. And that's really what we're designed to be, your virtual back office. So we have 30 folks here in the Walnut Creek office. The tools and comparisons, These are things that are extremely valuable, and I wanted to share with you how this works. Because when we go in, this is, for example, is our website. And so let's say I want to go under partners, and I go under Anthem Blue Cross. If I need to have a brochure for Anthem Blue Cross, all the brochures are right here for ancillary, for health savings accounts, anything to do with medical, they're all right here. And then if I need something in forms and applications, here's the employer forms, here are the employee forms. They're all listed right here. And if I know that they only want to have specific items, then I just check the items here on the left, and it goes into a zip file that I can send immediately to that employer. If the employer needs some plan details and they only want to be looking at 5 plans, we just click on those plans, and then we download, which is right there. And now it's in a zip file that we can actually send them. SPCs have always been challenging. So if you have an SPC, and again, these are required by law to make sure that these are sent to your employer, all you have to do is hit here. Let's say we've sold the bronze PPO 40 and the bronze PPO 5000. All we're going to do is click these two. Those are the two SPCs. But we're also going to go up here because the SPCs have to be dated with the current effective date on them. So we know if we sold those 2 plans to ABC Company effective 1/1/2019, we're going to go ahead and enter the date up here. So we know this was 1/1/2019. Those are the 2 plans were sold. We download those. Those are now in a zip file, and then we can send them to the group immediately. Anything to do with rates, the book rates are here. So if we have additional, if the group wants to have book rates on hand, so that way if they ever need information about new hires, all of those are here. So for every carrier we want to make sure you're aware of, those are all listed here. All of these functions are across the top to save you a lot of time. Now let's go into resources. We have something called Backpack, and this is where we put all of the resources that we find most helpful. So let's say, for example, we have an owner-only group, and we don't know which carriers. We know it's an S-Corp, but that's all we know. It's an S-Corp owner-only group. Who's going to take it? Well, all you have to do is go down to here, generate a medical comparison. Let's just click all the carriers because we don't know who's going to take it. And we're going to go over here, and as you come down, you'll see where it says owner only, which is right. I'm sorry, right. Oh, actually, let me show you something else. So let's click all of this, and let's say I want to go ahead and run a report. We can generate the details here, and let's put owner in here because this is an owner-only group situation, and we hit enter. Now you come down and you see how this is all of the carrier information is listed here. So we have an owner-only situation that is, it's going to be an S-Corp. So you'll notice with Anthem, if it's an owner-only group without W-2 employees, you'll see how it's okay. We can write it if it's a C-Corp or an LLC, but ours is an S-Corp, so they won't take it. None of the other carriers will take it either. As we come down, you'll notice that if we go all the way to the right and come back up, you see how United Healthcare, and you see how if it's an owner-only group, you see how they'll take the S-Corp right here. This is extremely valuable. We've had a number of groups blow up in underwriting, unfortunately, here in January because of these simple nuances that are tricky. And the other question is, does the W-2 employee, do they have to enroll or can they waive? And so now if you have here, you'll notice that if it's an owner only with W-2 employees, they allow the W-2 enrolling employee. So this is a great tool. If you have any questions, please let us know. But this is another great thing about our resources that are available to you right here. Now let's go to compliance. So one of the things we wanted to share with you is the required notice new group requirements. These are all, if you have a COBRA situation, we want to make sure you're aware. This is exactly the process that's needed if you have somebody going on COBRA. So they're all listed here, and this is all available on our site. So please make sure you take advantage of it. Now we're going to go back to our presentation. So the tools and comparisons are all available online. The other thing I want to make sure you're aware of is provider and pharmacy searches. It's right here. We have a gentleman in our office. His name's Patrick Kim. Let's say I'm going to be moving a group from Blue Shield to United Healthcare. The owner of the group is on medications, and they have a sick child. And so they have to have certain doctors, and they have to know that certain medications are going to be covered when you move the group from Blue Shield over to United Healthcare. We know that, let's say, for example, the pricing is going to be better, but I don't want any surprises. All you have to do is give us the provider list and the list of medications that they're currently on, and we will do a side-by-side comparison and let you know before the group is transferred over exactly how those medications and doctors are going to be covered, if they are covered. This is extremely helpful. That avoids a lot of grief after the group is enrolled when the owner of the company finds out that they can't get their medications and they're in a crisis mode. So please take advantage of that opportunity to make sure that you have a nice, smooth transition when you're changing carriers from carrier A to carrier B. Always ask the executive team and the CEO of the company, are there any providers and medications you're currently on that we want to make sure that you understand how they're covered when we make this change. So we have a number of brokers taking advantage of that resource, and it's really helped as far as making sure that there was no issues and you have a happy employer going forward. Increased connectivity with eCentral. Last year, we had 10% of our groups on eCentral. This year, 21% of our groups have come through eCentral, and that number will continue to grow. Online enrollment is here to stay. That is the trend going forward. So if you're not using online enrollment, please do an assessment of your agency. And obviously, we know that it's not for everybody. But going forward, it is going to be a bigger part of enrollments. And pretty soon, we're not going to be doing any more paper enrollments. The industry is going to be going towards this online enrollment tool, and we have eCentral available for you at no cost. So I would encourage you, if you're not familiar with it, please let us know. It's available to you at no cost. It allows the employees to get an email in their inbox. We set it up here internally. They will go through, enter their information, click on their plan design, and sign with their mouse, and they are done. It is far more efficient than paper, specifically if you have larger group sizes, because there's no missing items. They cannot advance to the next screen, and it's all legible. So we avoid a number of issues with incorrect names and chasing employees down to get dates of birth, dates of hire. And if you have not used it, I would encourage you to take one of your smaller groups, give us an opportunity to work with you on that, and you'll be pleasantly surprised at how easy eCentral is and why it's going to be the wave of the future as far as enrollments go. Underwriting. Right now, we have 1 to 3 day turnaround times for medical approvals. We're sending EDI same day to Anthem. As you noticed, Anthem is very popular when we went and looked at specifically Contra Costa County. What's happening is we get a group at 9 o'clock in the morning. We enter the data, send it to Anthem. We will have your ID numbers and group number by 5 p.m. that day or first thing the next morning. So it's the fastest turnaround time we've seen because it's going straight into the Anthem system. We're making enormous strides as far as cutting down the turnaround times and getting your approvals faster. As I mentioned, we have the initial online enrollment is available to you at no cost. We're happy to set up groups in eCentral. And for those of you that have an eCentral account, we're simply add as a guest, and then we will give $1.40 per employee per month times 12 into your eCentral account in order to offset your eCentral subscription. So if you have a group of 10 that you write through Beere&Purves, we give you 10 times $1.40 times 12 months goes to your eCentral subscription to offset that cost. So happy to do that for you. Our team here internally is really gearing up to be more of a mini account manager for your office. We do all of the admin meetings. We can make exceptions when needed. Any ads, deletes, or billing or claim issues, please let us know. We have Randy Halsey in our office here. He meets with the carrier management team on a quarterly basis to discuss best practices. Anytime we have a billing or claim issue, we've been very fortunate to get it to Randy, to get it to the senior team, to get some attention on it, to make sure that if there's an opportunity to make an exception, 95% of the time we'll get that done for you. Quote enhancements. We want to find out this year how you're doing your quotes, because we have a quoter assigned to each of your offices, and that quoter is very efficient in how to do the quotes. If you have somebody doing it internally, it's important for them to understand that there have been a number of changes in eCentral, in Health Connect, which is our quoting system, and they want to make sure that they are using the enhancements. For example, you can sort by current and renewal on the same page. You can link to the benefit summaries. Your logo should be on every quote that we provide for you. We want to make sure that you are viewed as unique in the industry. Any opportunity to differentiate, we want to provide that for you. So your company logo, if you give it to us, we will put it on the quote and send it back to you. That way it's a personalized quote and really makes it look professional when you're out presenting to your groups. They have a broad and narrow network on the top, so no surprises. We want to make sure that you're always using the broad network whenever possible. So that way we minimize the opportunity for somebody to be out of network. And our website, as I mentioned, we've got the SBCs all available for you. We can do custom searches, so please take advantage of all of that. Now let's go on to why sell. So first thing, each of the carriers we're going to talk about today, we're going to start with Aetna. The second quarter rates, we're going to give you an understanding of when they're going to be out, and then what is selling from our standpoint, and the unique components of each of the carriers. So let's start with Aetna. Aetna is for the 4/1 rates. They have not, there's no filing update yet, so we have not heard when those rates will be released. So no update yet. The plan that we're selling is the HSA 6,000 deductible. That's the bronze. That was our top selling plan. So I want to make sure that if you're looking at that, go back to that document that we went through initially, because that'll tell you the most competitive. But all of 2018 and into 2019, the plan that we're selling the most was the HSA bronze plan, very competitively priced. As far as the benefits go, they've got one full HMO plan, which is that gold. They also use HEAL. A lot of you may not be familiar with HEAL. HEAL goes back to the Wild West when the doctor comes to your house and gives you a house call. So doctors on demand, basically it's like dominoes. They're going to be there in 2 hours or less. They're going to come over, figure out what's going on with you, and they can come to your office or they can come to your home. It's amazing service that's available, and I would encourage you to talk about it, because rather than waiting hours in a doctor's office where there's a lot of contamination going on there, the doctor will come to you. So keep that in mind. Some of the network changes with Aetna. They're no longer selling the PPO or indemnity plans. So if you're out of state, you must reside in an MC network to be eligible. So that's important to know. And when you choose plans, you can choose up to 5 across all networks. Now, we do have the groups that we sold in January. We had brokers said, I just want an HMO PPO. And I went back and said, hey, you do get to pick up to 5 plans. You know, we can keep them behind the scenes. I would recommend picking 5 in advance. Otherwise, you can't go back and grab another 3 if you need it. For example, if I'm going to come to work at your company and I want an HSA and you only offer an HMO PPO, you can't give me the HSA. So let's grab the HSA off the shelf and put it in play initially. So that way, if you have a new hire coming on, you have that added flexibility. From an underwriting standpoint, they are very tough with Aetna. So we want to make sure you're all aware. If you have a group, and this happened this past year, we had a group that they did not submit it by the 20th, and therefore it rolled. So if you have a group and it's not submitted by the 20th of the month prior to the effective date, you're not getting the first month of that effective date. Does that make sense? So, for example, if we have a November, we have a 12-1 group, and we didn't submit it by November 20th, we don't get 12-1. It rolls forward to 1-1, where the rates change, plans change, and it creates a nightmare. So please be careful of that. Any Aetna group, make sure you get it in by the 20th of the month. For groups that are over 20, you don't need a DE9C. All you need is that prior carrier bill. So that's really helpful in certain situations. And startups, all you need is 2 weeks of payroll. And those are the primary items I wanted to share with you on that one. Moving on to Anthem. Anthem's going to have a rate increase the second quarter. So if you have groups that are considering Anthem, have them complete the enrollment paperwork by 3/1. Don't let it roll to 4/1, because there's going to be a 6.4% rate increase. So please give them a heads up if somebody's waffling whether to go 3/1 or 4/1. Get them 3/1, because they're going to have a 6.4% increase effective 4/1 with Anthem. The top selling plans are there. You'll see the platinums as well as the silver. Some of the key changes we want to make sure you're aware of. There's 4 new EPO plans, And again, EPO simply means no out-of-network benefits. You're going to get the largest network, which is Prudent Buyer. That's in-network only, but you do not get out-of-network benefits. Now, it's really hard to go out-of-network, but again, a lot of times people, when they see there's no out-of-network benefits, they panic. What you want to do is educate people and say, when was the last time you went out-of-network? And most people have not. So it's not as big of a deal as it's made out to be. If you put somebody on a PPO plan and they do go out-of-network, they will get crushed under Anthem because they are increasing the deductibles $2,000 and up. So anybody going out of network is really going to have a huge problem, and that's why the education for the employer and the employees is so critical when you go to these open enrollment meetings. Please educate them on how to stay in network, because it's really tragic when somebody gets a bill simply because they didn't understand that that doctor was not in the network. The other thing was, as we talk about HSAs, they've changed vendors this year. It's ActWise is the new vendor, so anybody on an HSA, just be mindful of that. And they've also changed BIN numbers for RX, and they're listed there on the screen, so just be mindful of that as well. You can walk into a CVS, get a 90-day supply of medicine from Anthem, but you're not going to have any savings. But you do have that convenience. They're one of the few that actually provide that service. Infertility is becoming huge right now, and oftentimes, obviously being extremely expensive. Anthem offers a 10 to 40% discount on infertility treatment, including medicine. This Win Fertility is something that a lot of brokers are not aware of, but we're finding that this is becoming a very hot topic here in 2019. So please make sure you're versed in it, and make sure that if you do write a group with Anthem, please make sure you explain Win Fertility to the employees, because this can save them a significant amount of money. Live Health Online. I just used this the other day. Hopefully none of you got sick over the holidays. Unfortunately, I did. And what I did was I actually went to Live Health Online. I'm an Anthem member, and I selected from the 10 doctors that were available. I hit the button, and it said, one will be with you shortly. And I had a sore throat, so I took a picture of the throat and sent it in. The doctor came online, looked at the picture, asked me a couple of questions, and sent the prescription off to CVS, and I was done in 15 minutes, and it cost me $49. So anybody who's not using online, which is going to be Heal, they come to your house and the doctor is with you. But what we're finding is that the millennials and others who are versed on their handheld device, and by the way, just on a side note, as you're marketing here in 2019, you want to make sure that you are using anything that can be done through your cell phone. So what I'm meaning is if I'm a brokerage agency and I'm going to be marketing my agency, I want to be using ads that can be purchased either on Facebook, Snapchat, LinkedIn. That is the future of marketing. Do not put your money into magazines, mail. None of that is working at the moment. So you need to transition. And if you have any questions on that, I'm happy to answer it. But we are starting to see migration to everything is going to be done on the cell phone. And you have to focus your marketing efforts and your entire campaigns through that device. That is where everyone is focused. So going back to Live Health Online, I was able to contact my doctor online, got the situation resolved, and off I went. So please make sure that you're educating employers and employees on the ability to get to their doctor with their cell phone and save an enormous amount of time and never leave the house. As far as the networks go, you can only write 2 HMO networks alongside 1 PPO network. What does that mean? That means I can have a full and a narrow HMO, but I cannot have a full and a narrow PPO. So that's important to know. We did have somebody that's put together the Select PPO and the Prudent Buyer PPO and offered it to their group. You cannot do that, so please be mindful of that. As we go into underwriting, as I mentioned previously, the underwriting time is very fast. We get approvals in 24 hours, and there's some of the promotions I want to make you aware of. As a producer, you want to know that I can offer the prior carrier bill in lieu of the DE9C if I have a group of 6 or more. This can be extremely helpful in a number of situations. If I have 7 on the bill and I go ahead and have 6 more enrolling, I just provide that bill to Anthem, fill out the employer application, and I'm all set. When I go alongside a Kaiser, all I need is 25% minimum 5. and individual coverage and exchange is valid. So that means it's very tough for me to go ahead and have a non-valid waiver. Only when somebody is not taking coverage and does not have a plan in place is that an invalid waiver. For those who, we are starting to see now that the economy was picking up, we had a number of startups. The company or the carrier that is easiest to get a startup through is Anthem. For example, if we're going to start a business, my dog walking company, I'm going to start up here on February 1st. If I have payroll starting on February 1st, I show up on the business portal as my dog walking company prior to 2/1. I can have coverage with Anthem effective 2/1 and payroll starting 2/1. Very easy. And it's important for you, again, when you're meeting with folks that are looking at starting up groups, make sure that they understand they have to be on the California Business Portal as an active group prior to the effective date in order to have that coverage effective. Anthem does go to the Sacramento site. It's called Kepler's. If you have any questions on that, please let me know. But they're going to look at that site to make sure that that company is active before they will give them coverage. Some of the other things to be mindful of is we have eCentral, again, available. I mentioned that. And specialty. All the carriers, the medical carriers, are really aggressively going after ancillary lines of coverage. As you know, there is a mandatory loss ratio for medical. There is no loss ratio requirements for dental, for vision, or for life. So if I know my profit is capped on the medical side, if I go over to the ancillary side, maybe there's another opportunity for me as a carrier to increase profitability. And so that's what we're seeing. And the bundling of groups is really going to be the trend going forward. Any group under 10, we would encourage you to write it with one carrier, because by the time they get one bill, you bundle the services together, they get a discount for that. And a lot of these ancillary services are very competitive. So please keep that in mind. As far as the ancillary lines go with Anthem, when you look at this sheet, you'll see at the top, Anthem Dental Complete, and you'll notice that the the dentists compared to those from the other top ancillary carriers here in the Bay Area. The specialty rates, they have bank rate bank for groups 26 or more, so that way you're able to negotiate those down. There's a 24-month rate guarantee for dental, vision, life, and disability. So that's important. And then you also get a 5% bundling discount for dental when you have the dental is sold with the vision, life, or disability. These are all big advantages of bundling with one carrier. And especially if that carrier is competitive, like Anthem is in Contra Costa County, this is a great opportunity for you. The dental benefits are listed there. Implants are one of the big things we get questioned on a lot. Implants are covered through the coverage in place with Anthem. They also have the 90% UCR, and the annual maximums are increasing, and you'll see up to $2,500 here. The other thing is that the DE9C is no longer required for standalone specialty groups, so you don't even need the DE9Cs, which makes it that much easier to make sure that groups sail through underwriting. Let's move on to California Choice. California Choice was our second most popular carrier in 2018. Followed by Anthem. And so with Cal Choice, what we're finding is a lot of groups are migrating at anniversary from Kaiser Direct over to Cal Choice. Now, why would I do that? There's a couple of reasons, actually. Number one is that the rates for Kaiser Direct are the same when I go from Kaiser Direct to Cal Choice. Number two, the unemployment rate here in the Bay Area is 4.5% to 5%. Anybody that wants a job pretty much has a job. So if I'm trying to recruit you to my company, the way I'm going to do it is to make sure I've got the broadest spectrum of benefit package available. If I only offer Kaiser and you have a sick kid that needs to go to UCSF, I can't necessarily say I can guarantee you're going to have access to that facility, because Kaiser does not work with them only on a rare exception basis. But if I can offer you Western Health Advantage, or I can offer you Anthem, I keep my base plan, and this is what most employers did that we worked with in 2018 and 2019. They will make Kaiser the base plan. They will offer 2 Kaiser plans, 2 Western Health, and 2 Sutter. All of those plans are very consistent in plan design, but the ability to access different doctors and facilities is significantly different. And so now all of a sudden I have the ability for somebody to go through Western Health Advantage, which is Canopy, to go through and have Hills Physicians or John Muir, and if they need to, be referred to UCSF. And it's extremely affordable compared to going to a traditional carrier like an Anthem or a Blue Shield. So this is what we're selling in 2019. And if you're not familiar with Canopy and how it works, please let us know. This is going to be the trend going forward. People are going to be buying access into UCSF through Western Health Advantage and Canopy. It's a significant savings to access the same facility versus going through a Blue Shield. And with no real participation restrictions going through CalChoice, I can have 30 on Kaiser and I can have 1 on Western Health. Typically, the owner of the company wants to go to a non-Kaiser facility. They want to have access to UCSF. So by putting together CalChoice as that option, you're giving them the ability to do it and also maintaining that budget. The top selling plans for us for January were the Kaiser Gold, the Anthem Silver PPO, and the Sutter Gold HMOB. The UHC has the Advantage HMO network. Canopy, as we talked about, you want to become familiar with that. That is a sales unique opportunity that not a lot of brokers are familiar with, and could make a huge difference as you're going after larger groups that are alongside Kaiser to get them out of the Kaiser and reduce the participation restrictions and get them access to a premier facility at a lower cost. When we talk about underwriting, we have 3 tiers that you can have. This is brand new in 2019. In the past, you could only have 2 adjacent metallic tiers. Now you can have 3. You can have platinum, gold, and silver. Now you notice you can't have bronze, silver, gold. So keep in mind of that. 10 or more, all we need is that prior carrier bill, but the variance cannot be more than 10%. So please keep that in mind. This is the biggie. When you're taking a Kaiser group and you're moving to CalChoice, it has to be moving on anniversary. We had a group, their Kaiser was 12-1 and the Anthem was 1-1. And we're going to move them to CalChoice effective 1-1. Because the Kaiser piece was effective on 12-1, the group could not move. So it's important for you to understand the Kaiser renewal has to be in line with the CalChoice, otherwise it will blow up. So please make sure that does not happen to you. Also, if you have groups 1 to 4, you need 6 weeks of payroll. Group 5 or more, all you need is 1 week. The other thing regarding miscellaneous here, you'll see that there's no late fees. In the past, there was a significant late fee that caused an enormous amount of grief for the employer because it was simply a huge fee if they were late. There's no late fees now. However, there is an administrative fee, and please make sure you disclose this. We've had a situation where this created some issues with an employer. Now, again, I realize it's only $30 a month, but you want to make sure you're in full disclosure. So we sold the group. The group was not told that there was an administrative fee because it's $30 a month times 12. That's an additional $360 that they were not expecting, and they were not happy about that. So please make sure that that is disclosed. Covered California. We just became new members to license and sell Covered California in 2018. Very excited about that. They have streamlined their efforts. As we talk to brokers about Covered California, a lot of them have a bad taste in their mouth because of their prior experience, 6-hour hold times, and they've had, obviously issues getting paid commissions and so forth. We have been fortunate this year that a lot of those bumps along the way have been ironed out. And so now what we're doing is we're selling groups that want to go from Kaiser. They will either go to Kaiser to CalChoice or Kaiser to Covered California. The reason we go from Kaiser to Covered California is that the Kaiser rates can be less expensive. And the reason for that is there's no pediatric dental with Kaiser within Covered California. So there's about a 2% lower cost moving a group from Kaiser Direct over to Covered California, depending on the makeup of the group. So if they have a lot of children, it could be a decent savings. So this is something you want to offer your groups going forward because, again, when you're at Kaiser, there's really nothing else you can offer them. But if I can give you Kaiser at a lower cost, now you've got something you may want to have a discussion about. And again, I don't want to see you have a Kaiser group and just say, we're just going to roll forward, we're not even going to market it, and somebody markets Covered California, saves them 2%, and you lose a broker record letter. So please make sure you at least market that and offer it. Any Kaiser group should have a Cal Choice option and a Covered California option offered to them at renewal to make sure that you've covered all your bases. The networks are listed there. We have Blue Shield and Kaiser are the primary ones that we sell. There's no administrative fee. And again, there's a 2-year tax credit for groups. And this is important to understand. A lot of employers, specifically like law offices and dentists, you're able to have a 2-year tax credit if the group is less than 25 and the average wage is $54,000. And you also see where it says once you remove owners and partners' income. So we take the total salaries, we take the owner off to the side, and we take the remainder, we add it up and divide by the number of employees. If it's $54,000 or less, they are eligible for a tax credit. And that's significant. And so it's important. If you have any questions on how that works, please let me know, because this could be another sales opportunity in 2019 where you're going after law offices, dentist offices, other areas where there are typically an owner makes a lot, but all the supporting team does not, and they can get an opportunity to put a plan in place. They no longer accept groups with 51% out of state. That's a brand new change as of February, so please be careful of that. We were writing a lot of groups with Covered California because that rule was not in place. What's interesting also, we see the second bullet under underwriting, Kaiser to Covered California can occur off the group's anniversary date. That is contrary to what we just talked about with Cal Choice. Now with Cal Choice, if it's a 1/1 effective date, we can, if it's Kaiser Direct 1/1 effective date, we can only move to, let's say Cal Choice or Covered California at that date. If the group anniversary date is for Kaiser's 12/1, then we can, and now we're coming up on a 2/1 date, we can move that to Covered California because we don't have to have the anniversary dates to match up. Please keep that in mind. So you have that flexibility going to Kaiser Blue Shield under Covered California for a 2/1 when the Kaiser renewal is 12/1. But you can't do that with Kaiser because the anniversary date doesn't match up. That's important to know. They're startup friendly. They only need 2 weeks. The 2 adjacent metallic tiers are allowed. Cal Choice, you have three of the metallic tiers available. With Covered California, you only have 2. So that's important to know as well. So now let's talk about HealthNet. HealthNet, unfortunately, has been quiet for the last year or so. We haven't seen a lot of it. Their PPO rates will go up in the effective 4/1 to 3.9%. HMO rates go up 0.3%. What are we selling? We're typically selling the Enhanced Choice A, which is the full PPO network. And so that's important to know whenever you're quoting, use that Enhanced Choice A plan. When you look at the underwriting side, the 10 or more on with the HMO, the DE9C, bill and participation are not required. So that's through June of 2019. So that's helpful for HMO only groups with 10 or more enrolling. And you'll see the rest of the requirements listed there. Let's talk about United Healthcare. United Healthcare, their rates for 4/1 are going to be going up 3.3% on the PPO. The rates are going to be going up on the HMO 1.3%. The plans that we're selling are the Gold and the Select Plus PPO Platinum. We're selling richer plans here, which is kind of interesting. The networks, really important to understand that they have added another network, and we'll talk about that under the underwriting side. Well, as far as benefits go, we do have that fitness reimbursement. You're going to get $20 a month for you and your spouse, as long as you go to the gym 12 times. It goes right into your account, which is very helpful. So please make sure that folks, employees that are on United Healthcare, take advantage of these things. If you're on an HSA, they're going to give you $3 if you hit your walking goals. The one thing I want to caution you on United Healthcare is the formulary. They have the tightest formulary of all the carriers we just discussed. So when the rates are cheaper, we want to say, yep, let's move them to United Healthcare. But we're going to go back to that comment I made at the beginning, which is if you have your executive team on medications and on doctors, please give us that list when you're moving over to United Healthcare. And we're going to show you how they're covered through the medications, because oftentimes you'll be surprised at what they may or may not be covering. And that will avoid you a lot of problems down the road. On the bottom, the last one there on the benefits, you'll notice that they have a restaurant and engineering association. These are composite rates for groups 1 to 100. So anybody that fits the SIC codes for either hospitality or engineering, let us get you a quote. This is out of Illinois. These are composite rates. Sometimes they can be more competitive than the California rate. So at least make sure that you run that additional option through us, and we'll get those rates to you. We talked about the 6 portfolios. This is very confusing. Please make sure you educate your team. The 6 portfolios are now available. When you're quoting in Northern California, use Choice Simplified 3. The benefits, when you're quoting with UHC, the plan designs that you're quoting must fall into the column, which is going to have Choice Simplified 3. If you have 2 of your 3 plans offered in Choice Simplified 3 and one's not in there, you cannot offer that plan. It's very, very confusing, I guess is the best way to say it. So if you have any questions, please let us know. But Choice Simplified 3 is what you're going to be focusing on in 2019 for Bay Area groups. Also, when you have 2 staff models, so in the past, you could only have Kaiser and Anthem, Kaiser Direct and United Healthcare, Kaiser Direct and Blue Shield. With United Healthcare, I can now have United Healthcare and not only Kaiser, but I could have Western Health Advantage, or I could also have United Healthcare and I could have Sutter. So they're allowing staff model HMOs to be alongside as long as they have a minimum of 5 enrolled in California. And that's important to know. You can have, if I'm going to enroll a group and I have 80 bodies and I have my management team that are 5 and they're in California and they want to go to Stanford, I can go, those 5 bodies can go onto a platinum plan with United Healthcare. All the others can go Kaiser Direct and go onto a bronze plan. So now what have we done? In the other 2, CalChoice and Covered California, have to have the 2 adjacent metallic tiers. You could not do that scenario with anybody else because those 2 are obviously not 2 adjacent metallic tiers. But you can have your platinum and you can have your bronze if that is the scenario that that employer wants, and you can go UHC with a minimum of 5 in California and the rest to Kaiser Direct. So that's another option that is available, and we do see that happening. The participation certification form. So if I have a group of 10 or more eligibles, notice how I said eligibles, not enrolled. 10 or more eligibles, all I have to do is have the broker or the employer sign that participation certification form, and I do not need to show the DE9C. This has helped us in a number of scenarios, so keep that in mind. As we mentioned before, the owners, it's an owner-only group. I've got 4 other owners and myself in our new dog walking company. We are now an S Corp. We can all get coverage through United Healthcare because we don't have any W-2s. So United Healthcare is taking owner-only groups when they're a C Corp, S Corp, or LLC. So it's important when you have groups that are filing, and let's say I'm going to put my company together now, and I say, I think I'm going to make it a sole proprietorship. You want to step in and say, wait, if you're going to be offering coverage and you're going to be writing it off as a business expense, you need to go ahead and file your business as an LLC, S Corp, or C Corp in order for you to have coverage through a group health plan. Otherwise, you're going to have a W-2 employee. And that's really important advice. And if you're able to walk them through that process so they don't file as a sole proprietor or file as an LLP or something other than what's listed there, you save them an enormous amount of time and effort and expense. The 51% rule. So if we have groups that are 51% out of state, we can write those groups. So if you have a group that's in Washington State and that's where the group's headquartered, let us know. We're going to get you a United Healthcare quote, and we can write it in Washington State. The only groups or the only plan designs that we're not able to, states that we can't write in are Nevada and Colorado. And so the rest of the information is there. For the sake of time, I'm going to roll through the rest of these components. And again, this is the information regarding the United Healthcare packaging discounts that you're going to see there. The difference between this is that this is a savings off the medical. So when you put dental alongside of the UHC dental and medical together, you get a $3 savings off the medical. So keep that in mind. And the savings continue to add up as you add more lines of coverage. Ancillary lines, very helpful here. Now that you've gone through your medical renewal, now's the time to add additional lines of coverage if they had not already done it. So we do write Choice Builder, and you'll notice that it offers all the major carriers as well as no DE9C required. So that's helpful. Delta Dental had a rate pass for 2019. Employers is for workers' comp. And then Guardian, there's no waiting period with 5 or more. And they do offer implants all the way down to 2 or more. MetLife is also one of our top carriers. We have Travelers for workers' comp. We have Principal, which is for dental, vision, life, AD&D, LTD, and SCD. Principal had a big year with us this year, and so we've had enormous success with them. They're a relatively new carrier for us, so if you have any quotes that you need with them, please let us know. And VSP. VSP, you can't lose with VSP, one of the top carriers out there when it comes to vision. So what we've done is these are the top selling plans for January 2019 by carrier. This is what we've sold here at Beere&Purves. Delta Allied, whenever we talked about bundling, and Delta's concerned that you're only going to use them for dental only, but when you use them for dental, always ask for an IMED quote and then look for Unum for life, Unum for disability, because we have the ability to package those as well. So that's important to know. Ongoing maintenance, this is important. So you have a group with eCentral. We wrote it with you January 1st. What about the adds and deletes going on throughout the entire year? We are actually monitoring for a number of brokers all of their adds and deletes every single day at no cost for groups that were written through us. What does that mean? That means there's an enormous amount of time that is freed up for your internal staff, because as soon as we know that there was an add or delete, we will get that indication. We will send it to you saying, hey, we just want to let you know Charlie's a new hire. We've already sent it to the carrier for processing. Once that employee is processed, we send you a confirmation email back. Hey, Charlie's now in the system. We're all set. So for those of you that want to free up capacity in 2019, which is at the end of the day, that is going to increase profitability for your agency, we were happy to do ongoing maintenance for the groups that we write with you. But you're maybe saying, well, we don't have an agreement with Kaiser or Blue Shield. How is that going to work? Let's say we write a group that is going to be with United Healthcare and Kaiser. We will go ahead and make all the changes to any adds or deletes that go to United Healthcare. Anything that are done through Kaiser, we'll actually pull that application and we'll send it to you directly. So that way you're able to go ahead and take care of that one yourself. But the monitoring is done. And that's the biggest part of what we find. And it's taking a lot of time for brokers and agencies. And we're happy to help you with that at no cost. Thank you for joining us. As a bonus, for those of you that stayed with us all the way to the end, this is one of the things I wanted to make sure, now that things are slowing down, as you're going and basically making sure all your files are put together and everything is straight from top to bottom. Compliance, huge Achilles heel for a lot of brokers out there. What I want you to do is go through this compliance checklist. So every group that you have in January, and let's say we wrote a 12-life group, did you give them the SBD? Did you give them a summary of material modifications? As you come down here, this list, you better be able to check off each of these items, because the audits are increasing. And if I'm an employer and you're my broker, and I get audited because I didn't get an let's just say an SBD, I'm not going to be happy with you. And so did you give me the notice? This is HIPAA. Did you give me the notice of special enrollment? It's required for groups 1 to 19. How about the wellness program disclosure? How about the special health care notices that are required by law, the women's health, the mental health, the employer chip notices? Were all of these given to me by you, the broker, at the time the group was written? If not, I would encourage you to go through this now, and please make sure that all of these are worked on. As I send this to you, notice how the hand is underneath. This will actually give you an understanding of how each of these work and what each of these are. And for those of you that are out in the sales and marketing area, this is gold when it comes to marketing. If I call in a prospect and I say, hey, one of the things we do here at ABC Agency is to make sure you're not subject to fines or litigation by working with us as a broker. By the way, I just want to make sure that your current broker is making sure that you're in compliance. Have you received the items on this list? And I guarantee you, as you go down this list, I have never yet to have one broker that has all these completed. So this is a good way for you to be offensive and to go ahead and win broker of records by going through this list. It's also a good way for you right now to take inventory of your existing group, circle the wagons, and make sure that you're protecting yourself from somebody else doing this to you. Because by law, you should have these in place anyway. And if you have any questions on this, please let me know. I know we ran over a little bit, but I just want to make sure for 2019, you're off to a great start. You are going to see things slow down. Now's the time to crank up the marketing efforts. You're going to be using this required notice checklist. You're going to be educating your existing team. You're going to be selling ancillary lines of coverage, and you're going to be marketing through online resources like Snapchat, Facebook ads. These are at all-time lows. They're very inexpensive. Once Ford and GM realize that they're spending millions of dollars to have a TV ad placed and you're zipping right through it and nobody's watching commercials anymore, they're going to pour money into Facebook, Snapchat, and LinkedIn ads, and the cost of these ads are going to skyrocket. So right now, while you have the opportunity, go into these social medias where everybody's spending 3 hours a day flipping anyway. Get your company on there so that way you're getting branding and the opportunity to grow, and talk to your teams internally. If you have any questions on it, let me know, but that's where the future of sales and marketing is here in 2019. Thanks so much for your time. If you have any questions, let me know. I will send you a copy of this presentation later today, and we look forward to seeing you in 2019. Take care. Bye-bye.